Struggling with your squat depth? If you're aiming to optimize your squat form and mobility, lateral hip traction might just be the game changer you're looking for. Our hips endure a lot, from long hours of sitting to intense workouts in the gym. Lateral hip traction is a fantastic mobilization technique designed to combat the compression and stiffness that can build up over time. By applying a band and gently pulling the hip laterally, you can effectively restore hip flexion and improve internal and external hip rotation. But before you dive into this mobilization, it's crucial to assess where your squat form might be falling short. Test your squat depth to pinpoint any mobility or stability issues you may be experiencing. Now onto the mobilization itself. Anchor a thick superband at hip height while kneeling. Then loop it around your thigh, pulling it up towards the groin. Assume a quadruped position and begin to move sideways away from the anchor point until you feel a moderate 4 to 5 out of 10 resistance from the band. Rock back on your heels, focusing on the sensation in your hips. After a few reps, note where you feel restricted and begin to oscillate forward and back around 1 to 2 times per second for 15 to 30 reps. Remember to maintain a neutral or slightly posterior pelvis to avoid discomfort or pinching in the front of your hip. And as always, if you feel pain during the mobilization, stop immediately. Once you've cleared the joint in pure hip flexion, explore the combination of hip internal rotation with lower leg outward, repeating the steps. Then try it with external rotation with the lower leg rotated inward. Repeat these steps on both hips to create more freedom of movement. After completing the mobilization, reassess your squat form. Notice any improvements in your ability to reach greater depth with ease. Ready to elevate your squat game? Give lateral hip traction a try and unleash your full potential. Hit follow for more tips and techniques to enhance your training routine.